name is Ruth Kavuma of Uganda. I'm a former member of parliament since May in Uganda, representing the islands in Lake Victoria called the Sese Islands. And I'm still a member of the network of African women ministers and parliamentarians. And that is in Uganda. What we have done in Parliament has been basically trying to look at the visibility of family planning. As a network member of AWLN, and also as a network member of the network of women parliamentarians and ministers in Uganda, we looked at how family planning is being perceived. And since 2007, we've worked very closely with Reproductive Health Uganda, which at that time was called Family Planning Uganda, and brought in the idea that the name needs to change because of the way family planning had been perceived by many people. And really many people thinking that if you are talking about family planning, you are only talking about those people who are in a steady relationship, if possible, or you are telling the young ones not to have any children, and it was negative. So we worked with Reproductive Health Uganda, which was family planning then, to rename the organization to be more embracing, and to look at the whole sexuality issue of women, maternal health, sexual health, menstrual periods, and all that, in order to be more embracing. That we have looked at, and we have managed to do the renaming and rebranding of family planning, and also tried to look at as the roadmap to the reduction in maternal health that was signed by the president, and that meant a commitment, because it meant money being attached to the issues. And one of the issues that I expect to carry on and move forward is basically the relationship between girls' education and reproductive health issues. How do these two merge? How do they help each other? How does education, especially girls' education levels, how do they help in making sure that the reproductive health, even their rights, actually sexual rights, are dealt with by the country and by the policymakers, by the government. So this relationship is going to help us. As a member of Forum for African Women Educationalists, we had already looked at the issues, dropouts. At the moment in Uganda, there is a vague policy about re-entry for the girls. If a girl got pregnant, are they going to be allowed to go back to school? Are they, just left as a dropout? And our argument has always been, because we've got USE, Universal Secondary Education, and Universal Primary Education, which is being funded by government. Now, when this girl drops out and is not allowed to continue, how much in terms of resources is lost by government for so many girls who drop out of school and just left to go? So we are trying to relate this and to bring it to the government to realize that we should not be losing those resources. We should be able to get a policy that allows the girl to go back to school, continue with school, and be able to be more productive. The way forward with what what I expect to look at is basically going to be make sure that a clear policy comes out that is going to be dealing with re-entry for the girls. And we want it to be very clear we want to make sure that enough sensitization is done both for the parents and for the students and also for the teachers in order to end stigma around pregnancy at school. So as we have tried to do with HIV/AIDS, and also look at the when we look at funding in reproductive health, we also need to look at the relationship between HIV and reproductive health, so that we have found before, as we have been looking at the different, going through the different hospitals, there is a clinic for HIV/AIDS and another clinic that is going to look at reproductive health, and these two never meet, and yet the transmission of HIV/AIDS in Uganda is basically through the same process as the reproductive health, as getting a child. So we really would like to make sure for the future, to make sure that these two are moving together. If there is a clinic on HIV/AIDS and reproductive health or maternal health, they should be integrated so that we don't separate funding and in a way, in most cases, cause unnecessary competition and replication in the same system.